Andrew. How are you, man?
I'm all right. How are you?
Good. Can you hear me?
I can hear you perfectly.
Perfect, because I was going to put the headset, but forget about it.
No, perfect.
There we go. So how's it going, man? Let's see. A lot of people are logging in. How's it going, Andrew? You're staying safe? You're locked in?
Yeah, well, I'm locked in most of the time. I'm going to the office a couple of half days a week just to stay sane and see some patients. There's only so much we can do by telephone. So,
yeah.
What about you?
Same here, man. Same here. I think pretty much 90% of Montreal, or actually Canada, let's say, for example, we're on the same page, right?
Yeah.
So let's see here. Have the balls to talk about it. Nick, padding. What's up, guys? That's probably Nick Drosos.
That's Nick Drosos, yep. We were talking about before.
There we go. A little wave to everyone. There we go. Perfect. So thank you for your time, man. Really appreciate it.
I got lots of time these days.
There you go. I'm really excited about this conversation.
Me too.
Because it's valuable content that I'm sure that we're gonna bring some valuable contact in somebody's household for sure. So for the people that don't know us, Andrew.
Yeah.
Dr. Andrew, right? Who are you and what do you do?
Okay, so I'm a doctor. I'm a urologist practicing in the Montreal area. Just to make a 20-year story into 20 seconds, I started off at the Montreal General Hospital and then moved actually to the South Shore. Wanted to leave the academic world, and my specialty was minimally invasive surgery. And that went on for about 15 years. And about 2.5 years ago, with everything that was happening in the system, whatever, I decided to pull out of Medicare and go private. There was a huge need for it.
How long ago was this? How long?
It was in 2017, so it was 2.5 years.
Yeah.
It was when everything was happening with our last government, and it was closures, and access was getting more and more difficult, and it was just getting frustrating, and the hospitals were getting more frustrating, being run by bureaucrats and so on. I decided there was not just for me personally, but there was a huge need for it. To be able to see patients quickly, to be able to see some of my patients are actually there right now, Tom. So, so after, I make it seem like it's a snap decision, but after a year of sleepless nights and planning and so on, I went private November 1st, 2017.
Bravo.
And it changed the focus of my practice because now from a hospital-based practice to an office-based practice, there's a very different type of illnesses that you see in both ends of it. So we start to see a lot of office-based. I mean, it doesn't. Some people here don't know what urology is. We deal with men, genital and urinary, prostate, bladder, kidneys, testicles, sexual dysfunction, all that. And women more. We do some sexual dysfunction overlapping with gynecology, bladder infection, incontinence, all those kind of stuff. So we started to move more towards in-office stuff, which is treatment of infections and sexual dysfunction, pelvic pain, testicular pain, erectile dysfunction, hormonal problems, and all that stuff. And then things grew. We'd since opened up a vasectomy division, a circumcision division. Actually, aesthetics grew out of it because we bought this laser, which was used for women, vaginal therapy. That grew into a whole aesthetics division as well. So there's a lot of underserviced people there, and a lot of need for these treatments, and we're working on it.
There you go. So I read an article a couple of days ago after we booked our appointment, and there's a common misconception that urology is only for men.
Yeah.
But
yeah.
100%. Talk to us a little bit more about that.
Yeah. So I mean, I would say at least 30% of my patients are women.
Yeah. So majority men.
Yeah. So majority men, but we do treat a lot of women. Again, we see women with bladder infections, incontinence, and these two alone are huge, huge problems. Women come in, and some of the problems that I see for male, we see in women, kidney tumors, kidney stones, that's all in our domain. That could be men or women. Blood in the urine, again, sexual dysfunction. Women is overlapped with us in gynecology. There's a bunch of things. There's some gynecologists that treat incontinence, and there's some urologists that treat it. But these are huge, huge, major problems. millions and millions of women suffer from these things.
Mm-hmm. And what's the most common condition that you face, well, with clients, men and women? Is it prostate cancer?
No, prostate cancer is very common, but benign prostate disease is still more common than prostate cancer. It is the most common cancer in males, or the top two. But in terms of the average guy off the street, I see a lot of men with difficulty to pee. That's usually caused by the prostate. That's what we call benign prostatic hyperplasia. And I would say the next thing is sexual dysfunction. And sexual dysfunction, I lump together erectile dysfunction, premature ejaculation.
That was my phone is
premature ejaculation, low sex drive, hormonal problems, that kind of.
Got it. And how can you prevent that? Can you prevent that? And how about any type of conditions like prostate cancer and so on and so on?
Nick wants to get his penis large.
Actually, let's answer that. It's a good question. What about penis enlargements? What's up?
Okay. So there's different actually.
So big pumps, penis pumps.
What? Yeah. Well, so actually, Nick Drosos and I have the balls to talk about it. Just recorded a show on that. So there are a lot of techniques out there. Nothing's miraculous. Okay. So some of the things that do work a little bit is a penile pump can work.
Made in China?
What?
Made in China?
At your own risk.
Okay.
Yeah, I mean, there's pumps and there's extenders. The extenders actually pull the penis, and the pumps actually, it's like a vacuum, and that's used for erectile dysfunction. So using that for about an hour a day has, in some studies, shown to lengthen the penis by a centimeter or so. You got to use it regularly. You know, there's some risk in that. You don't want to pull too hard and damage.
What's the risk?
If you pull too hard or if you pump too hard, you can damage the erectile tissue, and it could ultimately cause erectile dysfunction. I mean, it's rare, but some people are so, for example, the pump, you're supposed to use it for 10 minutes. But I've seen patients come in, they use it for an hour a day at too high of a pressure. That can damage the tissue. So you've got to sort of balance it. Whenever you're using one of these devices, you don't want to use it to the point where it hurts. So penile stretching devices, penile traction devices are okay. There's some people who inject, fillers. So we inject Botox for wrinkles, but the fillers like for lips and stuff like that. Yeah, so there are places where inject fillers into the penis to give it girth.
Really? Okay.
Yeah. So it does give it girth. I've seen some results. I don't do it. I don't, it looks sometimes lumpy. It looks swollen. It doesn't look natural to me. They do have a larger girth, and some patients are happy with that. But the aesthetic look, same thing with fat transfer. Some people will take fat from one area and put it in the penis. And I've seen a couple of patients come to me for second opinions where it's lumpy looking, and, you got to sort of, and there's nothing to do, but you got to wait till it, it usually goes away over time. But so that can bulk up the penis. There are surgical, they implant this little sheath that, it's like a semicircle that they implant under the skin just to make it look good. Again, I don't do them. So what I see normally is I see the complications. This guy had infections and serious erectile dysfunction after that. So, I try to stay away from them. If the most important thing to know is that about 50% of men are unhappy with their size, and about
50%?
Yeah, and about 5% of their partners are unhappy. So it's really an issue here for men more than anything. That's the majority. So with proper counseling and proper understanding, most men will not continue to seek help for it, and understand that it's normal and what the normal sizes are and so on.
Oh yeah, thanks for sharing. That's for sure. So for everybody that just tuned in, welcome on the Nick and Jimmy show, and we have Dr. Andrew Steinberg. on the show. If you have any questions, he's a urologist. If you have any questions, don't be shy. There's another question from Nick. Very good question. What process do you do, and what's the safest? I think he's talking about the enlargements, probably.
Okay, so the only thing that we do, we prescribe pumps and extenders. I normally prescribe them for other things. Pumps we prescribe for erectile dysfunction, and the extenders we normally use for Peyronie's disease. Where Peyronie's disease,
which disease?
Peyronie's.
Okay.
Like pepperoni, but without the first pep.
Got it.
So what it is, it's a scar tissue that forms on the penis, and usually on the upper surface. So when you get hard, instead of expanding like that way, it tugs it, and you get a curve of the penis.
Okay.
So when you use penile extenders, I'm trying to show this on the thing, it stretches out the penis and it heals in a more straight way. So that's what we typically use those for. So and we do use.
Is all this covered by Medicare or it's all private?
Private.
And what's the price tag on this?
Well, the extenders and whatever. I mean, it's just part of the visit. Those people get those online. We don't sell them.
Okay.
You can get for the penile extenders. You can get one.
Let's talk about the fillers.
The fillers I don't do, but I do something else. I'll come back to that. The fillers though can cost. I've seen patients go anywhere between $10,000 and $20,000.
Wow. And there's no guarantee around it, or there's a guarantee?
No.
Okay.
Yeah. So because you will get bulk. I mean, you're injecting bulk. Hyaluronic acid absorbs some waters, expands. I mean, same thing with the lips and the cheekbones, everything like that. It will have an effect. If you don't like it or don't like it, I don't think any plastic surgeon or aesthetics expert, gives, well, maybe some do, but money back guarantees. But you will get bulk. It's just that you have to know what kind of look you're going to get. So if anyone's thinking about doing that, do your research for sure. I've injected some. So we use PRP. I don't know if you've heard of PRP. PRP is platelet-rich plasma. So we take your blood, put it in a centrifuge, like 1 or 2 little test tubes, and remove the red blood cells. And what you're left with is PRP, platelets and plasma. Now the platelets have all sorts of growth factors and healing factors and so on. So this has been used in medicine. It's used in orthopedics, injecting into joints. It's used in dentistry. It's used in aesthetics. I don't know if you ever remember seeing a picture of Kim Kardashian, the vampire facial, with a bunch of...
I think so, yes.
Yeah, so that was PRP that they injected. We also injected into hair for hair growth. Yep, exactly. And, a lot of these things have been shown to work. So it then overlapped into the sexual domain. So we do this, the P shot, we inject it into the penis for erectile dysfunction, and the O shot, orgasm shot, for women, we injected it actually into the clitoris and into the G-spot. So to go back to the question, there was a study of a guy in Latin America who injected 1,000 men and then using a pump in between for penile growth. And he did show penile growth in the vast majority of patients, about 1.5 centimeters. There was some, he measured the girth as well. I don't remember the numbers on that. But these are, if we don't know, this isn't a placebo study. We didn't know if you injected with PRP or if you injected with water. Who knows? But it is suggestive. So I've had a couple of patients who saw that study and came to me, and we've done PRP treatments into there, and they both said, they've had some growth, and they've measured every centimeter and so on. But it's not going to take you from 4 inches to 12 inches.
Mm-hmm. You're not going to become a Jamal overnight, right?
No. Or Nick Jones.
Or Nick Jones. Choco Rodrigo, what's a normal size? He's asking. Because I think he's a 3-incher. I think.
Yeah. The normal size. I mean, look, there's that people look into the flaccid, and there's the flaccid stretched, and then there's the erect size, because some people have, are not, as they call themselves, this. They're growers, not showers. So they start off small and grow big and so on. But I think the average is actually about 9 or 10 centimeters with a flaccid penis kind of thing. And and there's yeah, that's about the. I don't remember what the girth size is, but some people are, because some people are bothered by the length, some people are bothered by the girth, but you know.
Perfect. What's the difference between, here we go, Tom Celis. What's the difference between the US and Canada in respect to how they measure the testosterone in your system?
Yeah, so I'm seeing more and more patients who are seeking testosterone. And I'm not talking about guys who want to, you know, bulk up and body build. I'm talking about guys who have, there's an illness of low testosterone. Some people call it menopause or andropause, but it's not the same as menopause in a woman for many reasons. But so these people come in, the classic symptoms are low sex drive, erectile dysfunction, and a lot of mental. They feel like they're in a cloud, they're not motivated, a lot more fat in the midgut, difficulty to, you know, exercise, difficulty to get up and go to work. And some of these patients are diagnosed as depressed and put on antidepressants, or, you know, they're just told it's in your mind and so on. But so we measure the testosterone on these patients, and that's a whole subject on its own, but I think that's what Tom's question was. We measure the total testosterone and see what it is. The problem is that sometimes the values, well, first of all, the numbers in the States and the numbers in Canada are different. We use different units, so maybe that's what his question was based on, but there's a simple calculator. Problem is that most of the cutoffs of what's normal are too low. So there are many people that I see, because the labs just do averages, but it's not a matter of averages. If someone is just a little bit above that average, but they're symptomatic, it's worth treating with testosterone. And I have guys who were feeling like this for 10 years and they finally get to see me. We put them on testosterone replacement therapy, and a month later they come in and give me a hug. I mean, you know, they feel alive again. So, and it's...
And what is that? What is that procedure? It's a pill? What is it?
There are pills. We don't use them a lot because they do have side effects on the liver, actually. The same pills, they're available in Canada. They're not even FDA approved in the States because of these side effects. Okay. There's creams, like a gel, that you put in your body every day.
Okay.
Easy to put on, but two things. Sometimes absorption is not perfect, so people don't get the full effect of it. And you just got to be careful to wash your hands so you don't, well, we're all washing our hands now anyway, so it's not an issue. But the best one is actually just an injection. Injection in the arm and the leg and the butt once a week or once every 2 weeks.
And that increases sex drive, you're saying?
For
and a few other things.
For people who are low, yeah. Yeah. Tom says injections are the best. Tom, I'm not going to speak for Tom because it's patient confidentiality, but Tom is a great patient.
Well, I guess he threw himself under the bus, right?
He threw himself under the bus, but he's a great patient, and he's a great man who's done his service for this country.
There you go. And these injections, how does that work? Once again, Medicare or private?
Yeah. No, those kind of things, you know, when you're private, you know, that you pay for the visits, you pay for the follow-ups, but yeah, medications, blood tests, and all that stuff you can do privately if you want, but you can do it, you know, anywhere. So the going for testosterone injections, actually, it's cheaper than the gels. It's a cheaper medication. You know, probably costs you $40 a month at the pharmacy, and you can self-inject. My nurse will teach you how to self-inject. It's really easy.
For a certain period or forever?
So forever. Yeah.
Okay.
So
what if you get off it? What if you get off it? What happens?
You know, there'll be a period where it shuts off your testicles. So there'll be a period where you'll be low and then you'll bounce back. But there are medications that we can help bounce them back, but it won't be, you know, if you're low here and we go up here, you'll go back to where you were being low again. It's like the thyroid. I mean, there's people who have so much stigma around it, it's testosterone, but it's like the thyroid. You're missing a hormone, and we replace it, and you're on it for life, and you feel much better on it, you know, and it's safe, and there may be even some benefits. You know, there was word about heart disease, but people with low testosterone and people with erectile dysfunction, by the way, are actually high risk of having heart disease.
Really?
Yeah, it's kind of, you know, we call it the canary in the mine. If you had a lot of these middle-aged guys with real erectile dysfunction, I'm not saying they got drunk and they met a girl and they couldn't get it up because they were stressed. You know, that's performance anxiety. But a real, you know, vascular erectile dysfunction or real hormone deficiency, I will often send them for a cardiac evaluation.
Interesting. Good to know, man.
Yeah.
Nick wrote here, is it true that a great peen exercise or prostate exercise, I think penis exercise, is that while you pee? You want to read that?
Oh, just to stop and start while you're peeing?
There you
go. I mean, I guess that's, if that's sort of like Kegel exercises that women do. I don't really know if, hey, we got Dr. Pfeiffer. We trained together. He's another urologist in Ontario. Hey, Andrew, welcome.
Welcome.
So, yeah, well, I mean, if someone's incontinent or having trouble to pee, maybe that, but it's not something I recommend my patients to do the stop-start exercise.
No. How about Viagra?
How about Viagra? Have you ever tried it?
Of course.
Yeah?
Yeah.
And? Works great.
It works. It's been a while I didn't try it, but yeah, it works like a charm.
Yeah, so it
good first impression before my wife.
Exactly.
She's not watching this, so I'm good.
Yeah, look, I don't know how old you are. I'm 51. So statistics.
You're looking good, man.
Thank you. Statistics: 50% of 50-year-olds, 30% of 30-year-olds have erectile dysfunction. So if you look back at some of these, sexual textbooks in the 80s, all they said was sexual dysfunction is, or erectile dysfunction is in your head, and all you got to do is relax and take it easy, and it should be okay. Finally, Viagra came out in the late 90s. I mean, my textbook from my training in urology, there was a one paragraph. There's a new medication being studied which may improve the nitrous oxide production, and So I mean, I'm not that old, but this was in my textbook. Viagra only existed at the end of my residency. So it came out, I think, in the late 90s or something like that. So, I mean, it works. And the great thing about it is we're very well tolerated. Some people have headaches or sore muscles, but those are self-limited. It actually works in the natural, like you don't just, people are worried they're going to take it, especially with Cialis, which are similar medications, because Cialis is 36 hours. Viagra is good for 8 hours. They think they're going to take it and walk around with a hard-on for 36 hours. It only works when you're excited. So it works with the natural. So if you take it and you start watching a football game, unless you're like men in tight pants, you're not going to get an erection. So that's the beauty of it. It works naturally. It doesn't change the underlying problem. You still have vascular disease and so on, but it helps a lot. And it's the beauty of it is it's brought so many people over the years out of the woodwork. Now they have an option and they seek it because there's so many men who aren't seeking it. Guys, if you have sexual dysfunction, if you have pain in your testicles, if you can't pee or whatever, please get help. The earlier we get it, the easier we can treat you. Have the balls to talk about it.
There you go. And let's talk about your show. Have the balls to talk about it. Why would you and Nick Geroso started that show? Very interesting, because you guys last year were talking about, I think, Viagra, Cialis, hemorrhoids.
Yeah.
So talk to us.
So hey, my brother's on there also from Israel. How you doing, Stu?
Shalom.
Shalom. We have. Okay, so Nick, I started training with Nick. I know it's hard to believe I need a trainer looking as buff as I am, but I started training with Nick, I don't know, 10 years ago or so. And I know he had his YouTube channel, 300,000 plus followers for self-defense and exercise and everything like that. And it was just, I see people, again, they don't come for help. They're afraid to talk about it. I mean, women are much better. Women, they're not perfect, but they do talk about their problems more with their friends, and they know when something's wrong. Most of them are seen by a gynecologist even more than they see their family doctor. Yeah. So it's more of an opportunity, but men don't talk about it. And we looked online. There's nothing out there for men. I get the same questions over and over again. The same.
Don't trust greasy.
So I get the same question over. So we just sort of said, hey, there needs to be a show like this where we get out this information and whatever. So it just sprung from that, and we just, I didn't like to be on video. This is not my specialty. And Nick said, yeah, we'll just do it. Don't worry. We'll sit. I'll ask you questions and we'll go. So we just set up in my office. We set up a camera and we just went, and we didn't even plan. We just said 1, 2, 3. Now we're going to talk about prostate. And he said, don't worry, we can cut and paste and edit and you know, we can put a mustache on you, we can make you look good. And then we just went and we spoke for, you know, 15 minutes with just one cut. And they said, okay, let's talk about vasectomy. Boom, 15 minutes straight. So we just connected, and we just, you know, we just kept going with it. And it's been great. Have the balls to talk about it. I take pride in coming up with that name. I think it's a great name, and it says exactly what it is.
I love it.
You know, we don't have the balls to talk about it. Most men don't. There was just, even last week, I think I said it on the live last week, there was an article in the Washington Post about the vast majority of men who don't seek medical problems even when they have symptoms. I'm not even talking about just going once a year, but I'm saying, you know, when they have an issue. And I see guys with testicular cancer, they notice a bump, but they're shy, they're embarrassed, whatever. They let it grow and let it grow and let it grow, you know, and they get these big cancers spread. You know, it's same thing. Erectile dysfunction. Catch it early, treat it early. It's better. You know, we got to get you to see Nick, because part of training, part of erectile dysfunction is getting your blood flow. It's like your heart.
Mm-hmm.
You know, blood flow to the heart is the same thing as blood flow to the penis. I have to answer that cell phone question because you asked it a couple of times. But you know, one of the parts of treating erectile dysfunction is lose weight, control your diabetes, control your blood pressure. In the end, most people say, okay, that's great. I'm going to try all that, but give me a Viagra. But you know, it's you know, think heart when you think erectile dysfunction. There's no real proof that cell phones cause testicular cancer or brain cancer. That's the bottom line. You know, there's no proof. There's so many conspiracy theories about all this stuff and waves, and now we're hearing it all with the 5G and everything like that. But all of that is really conspiracy theories, you know.
It's not proven facts.
Yeah, and what's good for the heart is good for the penis. That's true. Bottom line. And I tell patients that the heart is important. The most important thing about the heart is to pump blood to the penis. So keep your heart healthy, and you'll keep your penis healthy.
And what's one way to keep the heart healthy? Exercise, right?
Yeah, I mean, exercise, diet, smoking. I know smokers have been seen to improve. You quit smoking, there's an improvement in erectile dysfunction within a month. I'm not saying you're going to all of a sudden be like a 19-year-old, but there is improvement. There's no doubt about it. And some of the medications, you know, there's a natural product, L-Arginine. You ever hear of that?
Which?
L-Arginine.
Nope.
So L-Arginine is something you see in all these supplement stores and everything like that, or L-citrulline. And it's supposed to be good for the heart. But studies have been done showing it's good for erections also. So if anyone has mild erectile dysfunction, you can go find that in like GNC or Popeyes, those health food stores.
What is it called?
L-Arginine. A-R-G-I-N-I-N-E.
Cool.
I'm not one who pushes all natural products because most of them are full of it. But this is one that's actually been studied versus like real scientific studies.
Mm-hmm. All right. And how did the COVID-19 change your work ethic or your lifestyle so far?
Well, I come to work in a shirt, but I wear sweatpants on the bottom, so that's what.
There you go.
No more jacket and tie. Yeah, I mean, it's I don't know what's going to happen now. Now I'm working, calling patients. I mean, we're down by a lot of patients because patients aren't contacting us. So,
how do you give prescriptions?
We use an electronic medical record.
Okay.
And I can fax directly to the pharmacy within. You just tell me your pharmacy, send it, save and fax, and boom, it's there in a minute. So that's easy. What I do is I tell patients, again, because I'm private, so it's a paid for conversation. But if I need to see you, I will see you the next day at the office. Like if something needs to be, a guy comes in, he thinks he has testicular cancer. I spoke to him. I said, okay, I'll meet you at the office tomorrow at 10. I need to examine your testicles. So I don't charge extra for that. It's just part of the initial consultation. So that's why I'm going to the office a couple of days. But it's affected us all, and patients aren't doing their usual blood tests. You know, we see a lot of patients referred from family doctors. They have a high blood test for their prostate. They have a high, blood in the urine, but they're not going for the test, so they're not doing these. So what's going to happen is, we've come down like this. It's quiet, and when things pick up again, at least medically, all these hidden things are now going to come out.
Got it. And let's talk about hemorrhoids. The other time you guys were talking about hemorrhoids. Are you a procto too? That's another.
Yeah, proctologist, or I mean, a colorectal surgeon. They're more the general surgeons, and seeing some gastros do it. So I just use the rectum as a little window to the prostate. So I don't treat rectal or anal pathologies like hemorrhoids or fissures or anything like that. I just squeeze my finger in there so I can have a little peek at the prostate.
And when somebody gets hemorrhoids, it's from what? It's low fiber and not enough exercise, not eating healthy.
Usually the low fiber and low hydration causes constipation, and the pushing with constipation puts pressure on these blood plexus, blood vessels, and they prolapse out.
Mm-hmm. Cool. Now let's talk about prostate cancer, for example. If somebody is diagnosed, God forbid, with prostate cancer, where does it spread first?
So first of all,
how does it work?
Just even to rewind, the majority of patients that we see with prostate cancer now, we don't treat about a third of them. So it's such a spectrum of slow growing cancers. When we do a biopsy, it's analyzed by a pathologist. They look at it under the microscope and they rank it on a scale 1, 2, 3, 4, 5 of the aggressiveness. The ones will probably just grow. If you're 65, you'll probably die of a heart attack before the prostate cancer kills you. So we don't even treat those. We follow them carefully in another biopsy in a year or two, but they don't need to be treated, the vast majority of them. And I would say at least 25 to 50% of them don't even need to be treated ever. Some of them will maybe need, but treatment can affect your sex life. It can affect the way you pee. It can make you incontinent. So that's why we want to treat those who need it, but we don't want to kill a mosquito with a nuclear bomb either. So with the more aggressive cases, if you let it go, it'll spread. The two most common places it spreads is to the lymph nodes and the bone. And the bone is one common one. So if patients have difficulty to pee and start to have pain, if you have difficulty to pee, get it checked out already. But if you have difficulty to pee and start to have back pain, and it's you can't figure out, get that checked out yesterday.
And it's curable, right?
It's curable when caught.
It depends on the stage.
Depends on the stage. Yeah, if it's spread to the bone, we can give medications which can put it dormant for 2 years, 5 years, 7 years, 10 years in some cases, but it's never truly cured. And if you live long enough, it will come back. So
you have to do chemo and everything.
Chemo is the later phase. We do prostate cancer, believe it or not, grows on hormones. So testosterone. So if we can cut your testosterone, basically it's castration. We have medications that can in 30 years ago, they used to actually castrate you. They used to take off your testicles to treat prostate cancer.
Okay. And was it working though?
Yeah, it would work. But again, it would work for a certain amount of time. And then it would eventually, the prostate cancer would eventually escape that and grow back. But now we have medication. So hormone therapy is the mainstay. And chemotherapy is more later on in the game.
Got it. I was actually going to ask a very, very good question. I completely forgot. Well, let's talk about chemotherapy, actually. As a doctor, in your opinion, there's many doctors that are with chemotherapy, and there's many that are against it. The conspiracy theory saying focus on natural. It's chemo is a business. What do you think about that?
Look. Everything is a business, so that doesn't mean that there's, and there's unfortunately a few bad eggs here and there, but that doesn't mean that the treatment is bad. The people who are selling natural whatever, they're in business also, right? And if you listen to that business and you have cancer, you're going to die. So chemotherapy. Look, I've seen studies scrutinized and analyzed, and we have tumor boards at the hospital and whatever, and these things are presented in meetings, and I can go on forever. These things work, but they're toxic. But yes, they're poison because they're trying to kill the cancers. But if you want to kill these cancers, there's no. You're not having a salad and herbs and a little voodoo oil. These are real serious harmful medications,
Yeah.
but they work. So if you know, when the people do some cancer, you do a stem cell transplant.
Mm-hmm.
What they do is they have to kill all your good cells in your bone marrow. So yeah, these things are toxic, but you know, if you need it, you need it. And I don't think that this is again, back to conspiracy. I don't think this is conspiracy theory. You know, would I recommend you go to a naturopath instead of your oncologist to treat cancer? No. If you want to go for one on the side, and maybe they can help you in different ways and help you with nutrition, because you need to be nutritionally strong and all that stuff, for sure. I'm all for it. You know, I'm all for the paramedical sciences, but they need to be responsible. You know, we are held to, you know, the scrutiny, you know, beyond what we can even possibly reach. You know, anything that comes out, if it's not studied and randomized, control, prospective, placebo studies, and gone through all the literature, fine. But if you have a natural product, you can say anything. You can say anything and get away with it. You know, you can sit here and say, stop taking your chemo. You guys need to drink coffee to cure your cancer, and buy my coffee because it's made in a natural Swiss filtered process. And you can sell these by the bucket loads, and no one can stop you, because it's not a drug. It's not FDA or Health Canada approved. Yeah. You know, they're held to no standard, unfortunately.
Mm-hmm. How about vasectomy? What's the percentage of men versus women getting vasectomy?
Well, no women.
What's more common? Sorry, my question is, what's more common?
Vasectomies are more, or I don't know the numbers, actually. That's a good question. But
we need facts, Andrew.
Numbers. I can't say what. See, now you guys know that we didn't preload these questions.
It's not scripted.
Yeah.
We're just having a conversation.
So I don't know the numbers of men versus women. I can tell you one thing: vasectomy is the most effective and safest form of birth control. So it's safer than, I mean, a woman being on the pill, they have risk, hormonal risk, blood clots, and other factors. A woman going for tying the tubes, a tubal ligation, compared to a vasectomy. The tubal ligation, you're put under anesthesia. They poke something in your abdomen. It's much, much, much higher risk than a vasectomy.
Or transsexuals. Yeah.
Yeah. So the amount of people going for vasectomies versus women's birth control. I don't, again, I'm assuming you want permanent birth control, because obviously if you just want to do something to have, you want to have a kid in 2 years from now, I don't recommend vasectomy. But if the number should be 99 to 1 of vasectomy versus tubal ligation, or if not 100 to 1. I mean, it's so much easier. It's so much safer. The reason why we don't do it is because men are chickens, and bottom line.
But bottom line is, who should do it? Let's say me and my wife now, we have 2 kids, right?
Yeah.
Let's say in a few years, we're like, you know what? Forget it. We don't want any more kids. Should it be me or her doing it? Obviously, it's everybody to their own. Everybody has different choices.
No, yeah, I mean, my belief is 100% it should be you.
Mm-hmm.
Because, again, for her to be on birth control, if you talk about the cost of it, being on birth control, the pill for however many years, Jimmy should do it. See, there you go. If you talk about the cost of it, if you talk about the effectiveness of it and the safety of it, 99.5% it should be you.
And I could reverse it if I want, from what I heard, right?
Yeah, you can reverse it. It's not as easy as doing it. Vasectomy is 10 minutes, just freeze the skin in the office, little thing, cut. Even Nick had the balls to do it, actually. But to reverse it is actually a surgery, because you take these 2 fine tubes, and the canal inside the tubes is it's as thin as my hair, which is thin. And you do these little under microscopic surgery reconnect with these fine sutures. So to reconnect it is, it's a 1 to 2 hour surgery under anesthesia, but it can be done. And you can also extract sperm just with a little needle, little simple procedure, and do in vitro fertilization, or
Yeah.
So I tell people you should be planning. This should be planning on your permanent birth control, but who knows what the future is, and
Actually, yeah, Nick says, Andrew, I think we need to do it on the show. Actually, can we measure me right now?
Yeah. Hold on a second. I need to pinch it open.
And now, let me ask you a question, which this should have been actually the first question. Maybe I asked it or not. Why urologist? Why not heart surgeon? Why not dentist? Why urologist?
For me?
Yeah.
It's actually a story behind that, and it's a very chance story. So my second year of medical school, we did the rotations, and we did 4 weeks in general surgery, and then 4 weeks in one of the surgical specialties. So I go on the Friday before we started, I go onto into the teaching office, and I look down the list, Steinberg Urology, because we got randomly assigned. I ran in there. I said, no, I don't want to do urology. Please put me in anything. She said, I'm sorry. If you can find someone who'll switch with you by Monday, which was, 2 days, then we can switch you. So I spent the whole day. I saw everybody who was in my rotation, cardiac surgery, plastic surgery, this, that, orthopedics. I said, please switch. No one wanted to switch with me. And I started my rotation. And my mentor was Dr. LaPlante. He's since retired. I just had an amazing experience, and I just loved it. So
there you go.
That was it. Just like that.
And the rest is history.
Right? The rest is history.
Bravo. Nick, he asked us twice. Sorry about that, Nick. Are tomatoes good for your prostate?
Tomatoes have been shown in some studies to be good for the prostate, for sure, in preventing prostate cancer. It's actually the lycopenes in tomatoes, which is something to do with the color. I know other fruits or vegetables the same color, but tomatoes the best. And believe it or not, because most of the time when we talk about the nutrition in fruits and vegetables, we talk about whole foods, but lycopene in tomatoes are actually brought out by cooking them. So a whole tomato is not as good as a tomato sauce. So, for all of the Greek fans, there seems to be a lot of it there. Next time you make a souvlaki pita, just put on some tomato sauce.
Instead of the tomatoes.
Are good, but because they have a lot of tomato sauce. But
I love it. So, ladies and gentlemen, for the people that just tuned in, we have roughly 15 minutes left because Instagram gives us 1 hour.
Yeah.
Welcome on the Nick and Jimmy Show. We have Dr. Andrew Steinberg. And if anybody has any questions, don't be shy to ask Andrew. So, Andrew, what else should we know about prostate or about eating healthy? Give us some nuggets.
Give you some nuggets.
Is tzatziki good? Very good, Nico.
It depends from where. It depends where you buy it from. Is it good for your prostate? That I don't know about.
From my backyard.
From your backyard? Is that what you grow it in?
Yeah.
Yeah. So what else should we know about? I mean, you should start to get your prostate checked out at around the age of 50. If you have a strong family history or you're African American, you should start earlier. They are at higher risk for prostate cancer at an earlier age.
Okay.
When I say family risk, I don't mean that your great uncle had it in Greece 30 years ago when he was 97. I mean, if your father had it when he was 55 and your uncle had it when he was 52, I mean a strong family history.
This is for prostate cancer now.
For prostate cancer, yeah. Okay.
What about kidney stones?
Kidney stones, there's no screening for it. If you have it, you have it. If you've had one,
if my father had it, does that mean I'm gonna have it?
If your father had a lot of them at an early age, there is some rare family clusters of it. You can do. I could recommend doing two things. Guys, if you want an appointment, just call Karen. Karen is my secretary. She just logged in there. Karen, the man.
Hello, Karen.
So if you, the most important thing to prevent. So if you have a strong family history, you can go get an ultrasound. It's painless, it's benign, or whatever, just to have a look at your kidneys. Most important thing to prevent kidney stones, believe it or not, is water. Drink a lot of water.
Drink a lot of water.
Over 2 liters a day.
Okay. Tom, when should a man check for low T?
So there's so the recommendations are not to do it routinely. I'll come back to that because I disagree with that. But to do it if someone has erectile dysfunction, symptomatic, low testosterone, all those symptoms of depression and everything like that. But they say don't, as an annual physical exam, you shouldn't necessarily do it. So there's two reasons why I think that that's not true. Number one is because if you come in now and your testosterone is sort of normal, a little bit low, but you have symptoms, well, that's possible. It's because it used to be much higher. So I think it's good to have a baseline so we know what to compare it to. So, if the normal range is, let's say, 10 to 30, and you're at 15 now, but your body's used to having you at 22. Well, that 22, it's important to know. So it's good to get a baseline of your testosterone.
Okay.
The other thing is some people have a low testosterone, even though they don't have symptoms, and the debate is whether we should treat them or not. And some of these people are with low testosterone, and they actually have hidden symptoms. You ask them and you push them about it and say, yeah, maybe I haven't been, sexually active lately, or maybe have gained a lot of weight and trying to, I used to be able to get it off just by going to the gym. Now I can't. So if you push them a little bit, some of these people may have symptoms and it may be worth exploring. So guidelines say not to do it. I say do it. Welcome to my buddy, Dr. Shuker. Shuker is the guy who does 1,000 vasectomies a year almost in our office. So
bravo. How many?
Oh, how much did we do last year, Elroy? 800 or something?
800.
Something like that. 800 a year. I mean, he's amazing.
No. So Rod here is saying, Nick wants to know if too much masturbation is bad.
Nick wants to know. Nick wants to know if masturbation is too much. Masturbation is bad.
890. There you go.
Yeah. There's a joke like that, a urology joke. The patients, the doctor says to the patient, "Sir, I think you need to stop masturbating." And the guy says, "Why?" And the doctor says, "Because I'm trying to examine you." So, yeah. So I think too much is bad. I guess what too much is debatable. But if you're in a relationship and you're using it to escape what's happening in your relationship, probably not probably bad in that instance. And also, if you are used to sort of more, Tom is the best. If you are, if you're used to your hand and everything that your hand does, and maybe watching porn with it or whatever, it may be harder to be in a relationship with another partner. So from that point of view, it's, there may be some harmful. Some people can masturbate 3 times a day and are perfectly fine with their sex life. Mm-hmm. So,
got it. So Omorphia Naturals, which is
Layla, hold on. Layla didn't ask us any questions, and she has, so we want a question from some women also. All right, Layla, send us a question. Text us in a question.
Let's do it. So here, should the men start doing checkups for prostate at a younger adult age?
Yeah, well, we just talked about this. So, I mean, I think 50 is, and again, there's a lot of debate around prostate cancer screening. So I'm just using sort of my experience and my take on, you get 5 sets of guidelines, the American Urology Association, Canadian, and all over the place. But yeah, so typically I start at the age of 50 and around 40 if there's high risk. And it's not just, the old finger. But there are, Nick said to share Costa's story. So Costa is a friend of Nick's, and I can tell the story because he's come out on, we've had a couple of, had him on, a couple of times. So Costa, now I said age 50 and then 40 if you have a family history. Costa's family doctor did a PSA on him, the prostate cancer blood screening test when he was in his late 30s. Now, I'm not sure if it was ticked off by mistake or the lab did it by mistake or he wanted to get a baseline. Yes, Layla, of course I know about women. But Costa's PSA was high. And the guy said, must be a mistake, let's repeat it. Repeat it again, it's high. So I spoke to Costa through Nick, and we had him set up to do a biopsy of his prostate. And 38 years old, I think he was 38 or in that ballpark, the guy had prostate cancer.
Man.
And not just a little
what stage
of it. He had it early stage 1, but but it was a significant amount. It was, you remember before, earlier on in the conversation, I said, well, we watch some patients. His was not one that we can watch. It needed to be activated. So his prostate taken out. And if this guy waited till he was 50, another 12 years, he's 36. Wow, yeah, he's even,
young.
If this guy would have waited, which everybody would have waited because we don't recommend prostate cancer screening at that age, he probably would have died from prostate cancer because this would have never been picked up in time.
Mm-hmm.
So again, we can't make health policy based on one weird story, but it just makes you scratch your head. And if you're Health Canada trying to plan for 35 million people, we don't say we don't tell everybody check your PSA every year, but it's not a bad idea maybe to get a baseline somewhere in your early 40s. Again, like I said with the testosterone, just get a baseline PSA. Yeah, it is a scary story. Karen gave my phone number to book an appointment, and the one below that is Shazzy. She's my nurse. So if you go for a biopsy, Shazzy's going to be holding your hand. That's Sharon.
There you go. Nick sent a text here. He says something about water. Someone said that drinking too much water is not healthy. Is that true?
Well, drinking too much water in certain cases, you have to drink a lot of water for it to be dangerous. 5, 6, 7 liters of water a day, because you have electrolytes. You have salt in your blood, basically. Not basically. You have sodium and chloride and potassium. And in rare cases, if you drink too much water, you can dilute and your sodium levels become too low. But you got to drink a lot on a regular basis. And of course, or if you're in kidney failure. But you and I, if we drink, I don't know how much you drink in a day, but I drink maybe a glass of water. Most of my water fluid comes from coffee, but I don't.
So that counts.
It counts as fluid, yeah. Yeah. So people, I have patients who come in and said, doctor, I've been peeing, every 20 minutes, every 30 minutes, and I saw 3 urologists, and they kept on putting me on these medications for my prostate, but I'm still peeing. I'm up all night. So I said, okay, well, how much fluids do you drink? He said, I drink almost no water, right? Nothing. I said, okay, well, what about coffee? He said, well, I drink about 12 cups a day. I'm saying, stop drinking coffee or drink 2 glasses of coffee a day. The guy came back.
How many cups of coffee? 12?
2. He was drinking 12 cups of coffee a day. Okay. So he came back a week later and gave me a hug. He said, you cured me.
There you go.
I could sleep finally the first time. So yeah, water, soda, all that stuff is 90%, it's all water. My mother's asking is if single malt scotch is good. So yes, Dad, we'll have an online shot tonight on Zoom.
Cheers. Have one for me. L'chaim.
L'chaim. So too much water is dangerous if it's really too much, but your body can handle several liters a day. Yeah, that's my daughter. See, I got my whole family here. My daughter now. Coffee counts as water. You're my favorite doctor. That's my daughter. So, and she's my coffee drinker in the family.
There you go. So for anybody, well, actually here, because me too, I understood that. You drink only one glass of water per day.
Yeah, I'm bad. I don't like water. I like coffee. And I had a kidney stone once, so I should be drinking 2 to 3 liters of fluid a day. But I just, I can't. Some people are water drinkers, some people aren't. What do you drink in a day?
Not much, man. I'm a little bit more than 1, but maybe 3 a day, but I drink coffee. So maybe that balances?
Yeah, for sure. And people were worried about coffee, but there's a lot of potential benefits in coffee, antioxidants and so on. So I think that drinking 3 coffees a day, plus or minus 1, is probably good for you, not bad for you.
Yeah, plus some Greek coffee, not Turkish. I'm kidding. Come on. I'm sure Nick Joseph is laughing right now.
Yeah, for sure.
So let's talk about some advice for anybody watching this video that's a student that wants to be a doctor, urologist, whatever the case is, or an entrepreneur. What advice would you give them?
So I think the entrepreneur question is the same as the doctor question. There's no magic formula. The main thing is, you gotta know what you believe in. It's hard to someone for say, hey, I want to be an entrepreneur. You see these young guys now, I want to be an entrepreneur, but they don't have an idea. It's hard to start. What should I do? And you have to have something you feel passionate about, whether being an entrepreneur or being a doctor, and you have to be better than 99% of the people out there, which is you guys know what it takes. It's just hard work.
The harder you work, the luckier you get, right?
The harder you work, the luckier you get. 100%. I mean, is there some people who just overnight get discovered just because someone bumped into them on the street? That doesn't happen. It's blood, sweat, and tears. It's hard work, and and things come and go. But today in medicine, it's so competitive. I don't think I would get into medical school today. There's so many smart people out there. You got to build, specifically for medical school, you got to do incredible in school, and you have to have a CV like Mother Teresa. You got to work in an orphanage. You got to volunteer. You got to work on an ambulance. You have to have a great CV. So there's really competition, and people travel more from around the world for medical schools, from across Canada, from the States, from for McGill, because it was the English university, there wasn't a lot of competition from Chicoutimi and whatever. But now it's much more opened up, so there's much more competition. So there's a lot of English people, who won't get into McGill, where it used to be, I guess, probably easier from that point of view. But for the same thing, these people should be applying to, University of Montreal and Sherbrooke and then Quebec because they're great medical schools. So.
There you go. And let's say, for example, somebody just graduated to be a doctor.
Yeah.
Do you recommend for them to be an entrepreneur right away, or gain experience and work for somebody first?
I think that so I went, I've spoken to people who wanted to go private. I know one guy who went private right out of residency. I don't think I could have done what I've done without building my experience, building my reputation, building my knowledge, building my specialties for 15 years. So I think that if you want to, unless you want to just work for someone and, you need to build yourself. You need to gain experience. I mean, the next best thing about hard work is experience.
There you go.
Nothing they teach you in medical school prepares you for the real world. The most I learned was in the first 5 years of my practice. And I still learn because my practice has changed dramatically in the last 3 years. I'm still learning and learning and learning and learning. And you learn from other doctors, you learn from courses, and you learn from, in all our cases, from people around us. In my case, from patients. You asked me the question, what's the ratio of women or men doing birth control? I had no idea. Well, you know what I'm going to do after this? I'm going to go look at research. Yeah. So you got to listen. You got to have your ears, eyes open all around you.
We have 1 minute left. Yeah. 2 questions.
Yeah.
Question 1, Costa wrote here, I know soda is bad for the sugar levels. Is soda bad for the kidney stones? That's the first question. And second question, if you could close it, how can somebody follow you?
So for soda, I mean, it's not, it's great. It's not great because of sugar, and diet sodas are not great for other reasons. So, I think the best thing is water for kidney stones and for your health. I don't think you need to drink 8 glasses of water. I think that's a myth based on nothing, but you need to keep well hydrated. And of course, hydrated depends on how much physical activity you do. So, Nick Drosos works out a lot more than me. He should be drinking a lot more fluids than I am. And how can people follow me? Well, guys, first of all, go to YouTube and go to Have the Balls to Talk About It and watch our video series with myself and Nick. And my Instagram channel is Steinberg Urology, one word. That's a way you can join me on. You can ask me questions on that if you want to get to my secretary little questions, and we provide some tips and medical information, stuff like that. My website at work is steinbergurology.com.
There you go.
Anything aesthetics, you just send to Hakeem Jen, who's just signed in there. She's from she's our coordinator at Elna Aesthetics. If you have any aesthetics questions, so.
There you go. So number 1, Nick wants to book an appointment. Perfect. And number 2, let's talk about Perrier water, because earlier we were talking about soda. Yeah. And there was 2-3 people, including Nick, who was talking about Perrier. Is Perrier bad for you also? Perrier
actually has a lot of salt in it.
Okay.
Salt is not great for stones. So I mean, if you have water, and from time to time you have a period. It's not a big deal. But if your sole source of liquid, water intake is period, 3 or 4 or 5 a day, you're probably getting too much from that.
Got it. Perfect. So thank you very much,
And
everyone.
Just to add, one last thing. When you want to try to prevent stone, I said you should drink a couple of liters a day. You really should drink enough that you pee a couple of liters a day. So you need to drink, really, if you're sweating a lot, much more than that.
So that's a balance.
Balance.
Perfect. So thank you very much for your time. Really appreciate it. Ladies and gentlemen, follow Dr. Andrew Steinberg and follow the Nick and Jimmy Show. Thank you.
Follow us all. Stay safe, everybody. Stay home.
Talk to you soon, buddy.
All right. Take care. Listen.